So I am going to get started now, and again, for anybody who came in late, please pick up a clicker, please pick up an evaluation of the session, and make sure that you list 2 things that you have learned from any of the topics in any of the sessions that we've had in our Academy of Master Educators talk. I think that was, and a list of all the other sessions. So if you could do that now, please, we'll get started. And so good morning, and thanks everybody for coming this morning. When I give a talk, I get somewhat jazzed, and I'm always afraid that something's going to go wrong technologically. So I am stuck being a little bit out of my comfort zone, not only being anxious about technology, but talking about technology, and hopefully it works. You can tell how anxious I get. I bring 2 copies of the slides on 2 separate jump drives just in case something goes wrong. I bring a paper copy of my slides just in case technology goes wrong. And odds are nothing will go wrong today, which is great. So thank you all for coming. I have a couple disclaimers or comments before we start. One is that I am stepping out of my comfort zone, and I am sure there are many people here who are much more experienced in using the audience response system, and certainly much more technologically savvy than I am. And so we welcome a lot of discussion here. And when I timed myself doing this, I had left a lot of time for discussion. And hopefully that merits out when we really do the formal talk. The second thing is I have to thank Andrew for really setting up things and helping me. I know how to do and make my own slides on Turning Point, which is important because I think everybody who uses the ARS system should know about how to make a slide. But we sat down Wednesday and went through this to make sure everything technologically works. And Andrew is just an outstanding resource to make sure everything goes okay. Embedded in this talk are 5 or 6 audience response systems, because how could you talk about audience response system questions without having them? And I'd like everybody to participate. One of the joys of doing this is the anonymity of your response, so nobody knows what you're going to say unless they're looking at your finger when you press the button. But everybody should have one of these. They are coded 1, 2, 3, 4, 5, or A, B, C, D, and E, and I'll let you know when we're going to use those. There are some slides that look like audience response system slides, and they're not, so I'll have to kind of guide you through that particular talk. And I think those were the 3 things that I wanted to mention. We're going to talk about using technology to engage learners and assess learning, more effective use of the audience response system. What this talk is not is how to do the bells and whistles of Turning Point, which is the technology that is used and has been advanced for the audience response systems. And I'll talk to you about other ways that you can be more expert in that. It's not about the technology. It's formulating questions as educators that makes good use of the technology for our use in our lectures and for students. And one of my favorite quotes, and I usually start out my talks with the quote of the day, is this: "Technology is only worth using when it addresses a specific educational need or a deficit." So technology for technology's sake, and because we're in 2014 and we're in a game-oriented society of students, is not really the reason to use it. We as educators should use it for our educational need or when there is a deficit. And it has tremendous roles when used effectively. So this is the first audience response system question, so get your clickers ready. I am attending this conference because A, I get credit for it. B, I think the speaker is damn impressive. I would like to learn more about the effective use of audience response system. And D, it gets me out of doing something else. Oops. See? I was not supposed to do that. I put that in on purpose because you can see it. Because you can see how if you don't know your technology, things could be a little bit wrong. But I was hoping everybody would choose this one because I need an ego boost today. But I'm really, really hoping everybody came for this particular reason. This is known as an icebreaker slide. You should think about having an icebreaker slide if you're doing a talk to a group of people that you don't know very well, or it's one of the first times they've used an ARS, etc. And so tip number 1 of the day is you should think about preparing the audience with a warm-up slide. It may not be 100% necessary but it may be good in certain audiences at certain times, and it may get the group together because you may want to participate with other audience response systems later, okay? So I'm going to use this next part of the slide to talk a little bit among each other about your experiences with using ARS. ARS I'm going to refer to throughout the time because I'm tired of saying audience response system. I'll get some other nomenclature in a few minutes. But how many people have used the audience response system in a talk? So this is perfect. This is perfect discussion because we'll get to some of those pros and cons. And you've already mentioned some of the cons, some of the irritating aspects of it, right? In terms of the actual technology, some of the good things that we can do. And we'll go back and talk about that and maybe save some time at the end. I'll tell you what irritates me the most. I like audience response systems for all the reasons people said. I hate questions like this, to be quite honest with you. What is the prevalence of obesity prevalence in Colorado? And the choices are 10, 20, 30, and 40. I hate those. I know you know the answer. Just a minute.
Is this before or after they legalized pot?
This is before, because you're right, it's probably bad. Because it's, it's a factoid question. It doesn't have much bearing to what you might be talking about. And the choices are so close to each other. Is there really a difference between 10 and 20%? There may be a difference between 10 and 50%, but these kind of questions irritate me a little bit. So I'm going to talk a little bit about the factoid or the responses being so close to each other that they may not be doing what you want the audience response system to do. So for me, these are no type of questions unless I really need that information to move forward. The answer to the question, Jamie, is, do you know?
I think it's 20%.
Oh, very good. It is 20. It's the only state in the country who has met the obesity requirements set by the government below a certain number. It's about 21%. Say again? So we don't know what's going to happen after the pot thing because those munchies could get you.
The automobile accident rate did not increase.
That's right.
In the first 3 months after the initiation of legalization of pot.
Right. All righty. So tips number 2 and tips number 3 are ask good questions, right? And we're going to talk about that more. What are good questions? And tip number 3 is give the answer and discuss it. So, if you're going to give a talk, going to give a question about the obesity rate in Colorado, geez, give the answer because everybody has invested time and energy into doing it. Some people ask it at the end after they've given the talk, but nonetheless, at some point during the talk, you should look at your responses and either comment on them or give the right answer. The goals of my talk today are attempting to bring the joy back to some large group teaching because we all know some joy has been taken away from that. To embrace simple technology in teaching, but to remember it's the content that's more important than the technology. And finally, to continue to try to engage our learners and as an outcome to enhance learning. I want to change the lecture room from being something like this, or in this day and age, something with the students in their pajamas watching podcasts, to more of what we remember in 3rd grade, with people actively engaged, raising their hands and hoping that Sister William Marie would call on them because they wanted to show them how smart they were. Okay, the objectives: to apply the principles of adult learning to large group teaching, to define the purposes of the ARS, and that's going to be one of the most important content of my talk, to state 3 things that make a question using the audience response system more and or less effective, and to try to use the ones that are more effective, and therefore to compose an effective audience response system question and to utilize it in your next large group teaching session. That, I hope, would be the outcome of the particular talk. And here's the outline of my talk. This is truly the outline of my talk. This is PowerPoint when I do 6 slides per page, and I put it on the floor and I look at it and I say, oh, I don't like that where that is. I'm going to move it around. But this does turn out to be the outline of my talk. However, this is better said. I'm going to review the literature of the ARS because we should know why we're using it, what other people have done before. But I'm going to concentrate on principles of style and of substance. Defining a purpose, defining a good question, designing a good slide. I think I only have 1 slide on that. And logistics, which are as important as everything else when all comes down to it. So but I'm going to focus on that because I think that's why we're here. But let's look at the literature a little bit today. Before I do so, let's get some nomenclature down. It's audience response system. I'm going to use ARS. The other thing is student response system. This one I don't like. It sounds too intimate. Personal response system. I don't like that. In the United Kingdom, they call them zappers, and we call them clickers in Pittsburgh. But I'm going to use audience response system, ARS, or clickers, the remainder of the talk. Okay, so let's talk a little bit about the literature in the audience response system. What do we know? In the outcomes compared to standard talking head lecture, that is somebody who stands in front of the class, here is what we know. Most of it from undergraduate work, et cetera, and most of it from courses in physics, mathematics, calculus, statistics in the undergraduate literature. There is clearly, repeatedly, documentation of high level of enjoyment, attentivity of the student, and self-perceived increased learning. I concentrate on self-perceived increased learning because I'm not sure that's true. Some literature has found improved learning outcomes, but not all. And some of the studies that have been done have not been methodologically rigorous. Those that have been done in medicine come mainly from pharmacy, family medicine, OB-GYN residents, in which they compared standard lectures, passive, kind of what I'm doing right now, versus lectures using the ARS, which I'm going to do in a few minutes. They found that there may be some improvement in grades. Again, the studies were not very rigorously done, and a few have reported improvements in the passing rate. However, again, I'm going to repeat, this is not really 100% for sure. How about, we now know that adults like to be active in their learners. How about if we compared it to more active learning styles? How about if we compared audience response system that is thought to be active to other things that we do, like discussion, et cetera? The only thing I could find on this comes from a study by Martin from some particular website that I had to scrounge down that looked at 92 college students in computer science. Most of the literature is in this type of literature, in computer science, math, et cetera. And all students in these classes had the same pre-test scores. So they came into this class knowing the same amount of material among each other. These two sets of classes, which I'll define shortly, were in the same semester. They had the same instructor. They used the same textbooks. They had the same learning materials, and they had the same final assessment. The difference was that two classes used clickers in their discussion points, and the others used discussions, just like talking among each other with the same questions. So one group had the clickers, and they used that to generate the discussion and talk about it, and the other one just had like a seminar group type of discussion. More active learning because the students participated. The outcome was a score on the comprehensive exam. Everybody got the same exam. These were the study participants. There were two classes that used clickers of 22 and 23 students each for a total of 45, and two classes that used the class discussion, 24 and 23 for a total of 47. Again, the authors repeat that these were all active learning sessions. The results. Anybody care to estimate what they were on the final exam? No statistically significant difference. 85 versus 87. However, there may be other outcomes that we're interested in and that these authors were interested in, and they did assess them. They assessed the perception of the students. They used a Likert scale from 1 to 5, 1 strongly disagree, and 5 strongly agree. And they compared those 45 students who used the clicker to those 47 students who did not use the clicker but just discussed. And they asked 7 questions. I'm going to show the results right now and then the questions, but the results have a consistent theme. There was a trend toward improvement in the questions asked for those students who used the clickers versus those who used class discussion. And this was all perception. Those 7 questions asked the following questions. Did it improve your grade? It did not, but they thought it did. Did it improve your understanding? Clickers said yes. People who use clickers also thought that it increased their feeling of belonging to the class. That's cute. that increased their interaction with the instructor and the interaction with students. That makes sense. They enjoyed it, and they would recommend it. So no statistically significant improvement based on the Likert scale, but there was a trend toward all of these favoring those students who used the clicker. These are all positive things, so I don't think anything negative came out of this. There is no doubt, therefore, that students seem to enjoy it and they're engaged when they use it, if it's not overused and if it's used well. I would argue that this is necessary because we like to have our students engaged and enjoying what they're doing for a good learning environment, but it may not be sufficient. And so what other outcomes might there be? Well, I think there's never going to show that there's going to be an increase in high stakes tests for using the audience response system. That would be a very difficult study to do. I don't think other high stake tests will show an improvement. And I'm not sure it's going to lead to an improvement in our students when they're on the wards. So if we're looking for this for an outcome, I think it might be more difficult to achieve. What I do think is that there are other benefits, and I would like to concentrate on those for the remainder of the talk. Getting back to Bloom's taxonomy, I think we can push Bloom's taxonomy up to the more mature learner by using audience response systems. So not just knowledge and comprehension, and specifically not just a spitback of knowledge, but some comprehension to make sure what we're saying is being understood by our students. But where it can really be beneficial to students is if we ask them to apply information we've already given or that they have, to use it in the analysis and synthesis of new information, or to do some evaluation. So those of you who are familiar with Bloom's taxonomy, I would think that when you're designing questions, to think about the higher levels in creating your audience response question. There are benefits to the students. We have already mentioned the anonymity and the safety issue. So we can get rid of that question that students say that they don't like to be called on in front of their peers because they're worried about appearing not as smart as they would like to be in front of their peers. The audience response system, in essence, gets rid of that. It forces you to commit on an answer. So you have to really think about it, commit to it, which is a good part of learning. It can serve as an objective, informative self-assessment, such that the student, if they get it right, can think, well, heck, I am smart. Or, even as importantly, I better study more. I'm not getting things right. 80% of the class got it right and I didn't. And so it's a way of self-assessment if taken seriously. There are benefits to the faculty. It can improve student preparation. If they know they're going to be tested on it, they may improve their preparation. It clearly has been shown to increase participation and engagement. We've talked about that before. And if we're worried about attendance, it can lead to better attendance, maybe because the lecture is more integrated more interaction, and decrease attrition, especially when you link it to a grade. I think Paula mentioned that about she uses it for a grade. If you link it to a grade or part of the grade, you can increase attendance. However, you have to kind of think about how much part of the grade it's going to be. The literature would say that if you make it more than 15% of the grade, then attendance will increase. But if you make it less than 5, people don't care about it. In a pass-fail system, it may not be as important as a system where 90 to 100% is an A, 80 to 90% is a B, et cetera, et cetera. This is a study that looked at attendance and the use of audience response system. On the y-axis is the percent attendance. And I want to focus just on the non-exam days, with the yellow bar being students who were not given ARS and the purplish bar given with ARS. And there was a statistically significant increase in attendance from about 60% to about 85%. This was just one study. Attendance did increase. Yes. Yes. There's a special way that you can do that. Again, I'm not going to get into that, where a student's clicker is known, Asher Tulsky's clicker is known, and when Asher Tulsky clicks a button C and gets the correct answer, it's recorded and can be utilized by the teacher. It's a special type of arrangement that has to be done. Other faculty benefits, including assessing the student understanding in real time, knowing when you can push forward quite quickly if everybody gets it right, but have to pull back if only 20% have it right. You can control the pace. You can assure accountability. And this is important. You can assess the affective domain. And you're getting a sense for hot button or sexy topics that students might be a little uncomfortable talking about or revealing in the course of the lecture. So in summary, the literature. Students like it. Improvement in test scores, however, is not substantiated in well-done studies. However, there may be other important benefits to the student or the teacher in using them. And so maybe we should concentrate on those and not worry that if we use this, our students are going to score better on their test. It would be a nice outcome, but it's probably not going to be the main reason for using them. So I'm going to stop right now and get to the second part of the talk, which is principles of substance and style in defining a purpose of the question. The 3 questions you should ask yourself if you're going to use the audience response system question in sitting down with yourself is, what is your learning goal for that question? The second question is, what is your learning goal for that question? And of course, the third question is, what is your learning goal for that question? Okay, so our tip number 4, or the most important tip of the day, is every question that you put in should have a clearly identifiable learning goal. These are the goals that I have, and I'm going to pass out because as I do other questions throughout the talk, I want you to think, what was her learning goal, or what would my learning goal have been for putting in this question? So the first one is to judge knowledge and level of understanding. Baseline knowledge coming into the course, prior work. Did they learn what Dr. DeFranco was teaching about in his cell course when they get into reproductive endocrinology? Is it to assess the pre-reading in the flipped classroom that you've already given them? Or is it to do something in real time? This is my favorite one. I like to use it to apply and assess problem-solving skills. So when I do our audience response system, I like people to talk about a question, because I'm a clinician, and solve a clinical problem. Another group of objectives can be to generate interaction and discussion among students and among faculty, to elicit points of view when there may not be one right answer. Let's talk about whether pharmacists should deny contraception to a woman who comes in with a prescription for birth control pills based on his or her religious beliefs. To elicit points of view on sensitive or hot topics. That's another group of objectives, different from the first set. The other one is to generate feedback to the student and the learner, which we talked about, to evaluate the learning session, which you could put at the end, rate my teacher, or to determine portion of a grades. And finally, the last one, which is important to remember in our students, is to set the attention clock. It's now 8:30. I bet you 90% of you have vacillated from this topic already, thinking about other things of the day. What you're going to do next, what you're going to have for dinner. Oh my gosh, Monday's Memorial Day. I get a day off. And so this is a way to get you back into the thing, to reset the attention clock, which wanes in most students after 15 minutes, no matter how dynamic a teacher you are. So this is another, I think if I got this right and I routinized well enough, this is another audience response system question, and I hope it works out well. But why is polling closed? Oh, I know why. Which is true about the spinothalamic tract? It crosses over in the corpus callosum. It crosses over in the spinal column 1 to 2 nerve segments below the point of entry. It crosses over in the spinal column 1 to 2 nerve segments above the point of entry. It crosses over in the brainstem. Ah, shoot. This is really annoying. Because I went over it for an hour yesterday. Actually, what is supposed to happen, but you know, there's always contingent, is that thing is supposed to say polling is open. A time clock is supposed to come down to give you 10 seconds, at which time I announce, polling is now open. You have 10 seconds to answer this question. And that really feels like it's an hour, but our students are thinking about this. And they answer, and you have an answer, okay? Based on the piece of paper that I handed around in this particular question, who wants to volunteer what the purpose of this question was? What objective was I trying to achieve? Pure knowledge, right? And we know our students are really good at that. So they could be able to do this at home. You don't have to waste your time in the class doing this, unless they needed to know this question and this where it crosses over, and that it does cross over to get to your next set of learning objectives. So this is something they could read by themselves. It's not that difficult. It's pure knowledge. Think how much more rich the following question, which is thankfully not an audience response system question, but think how more rich this question would be in the neuroanatomy class. That's the right answer. A 52-year-old woman presents with loss of pain and temperature on the anterolateral aspect of the leg. Where's the lesion? L4, L5, spinal thalamic tract left, L4, L5 right, L2, L3 left, L2, L3 right. Here, it's a richer discussion, so Missy and I could sit, okay, I know that anterolateral is the L2, L3 dermatome, and I know it crosses over, so it's got to be on the other side. And there's more of a discussion, and it's a deeper question that gets interaction with the class and see what they all say. After explaining all that, where the dermatomes are, and maybe even having a map of the dermatomes on the slide to reinforce it, and figuring it out with the team as they discuss it among themselves or with you, and then discussing the answer, is a better use of the audience response system. The same thing for here. This is just nomenclature, which describes the loss of vision in the lateral fields. And I'd like to say all of these right now, but I'll probably trip up on them. Homogeneous hemianopia, and it could be hemianopia or hemianopsia, which I learned in doing this talk. Bitemporal hemianopia, homogeneous hemianopia, or superior quadrant hemianopia. You know, really, that's a question that I've seen in certain audience response system questions, but really, this is just a definition, and it's so easy. It's bilateral field, so it's got to be, you know, on the temporal side, and the answer is obviously be bitemporal hemianopia. But what about this question, which might be a little bit better, that gets a little bit deeper into it? A patient has an enlarging pituitary tumor and complains of vision loss. Which of the following visual field deficits is she most likely to have? And so the answer is going to be B, because this is bitemporal hemianopia. And that what you could even do with this audience response system question, again, content isn't important, I'm just trying to get at how we can use them more effectively, is then say to the students, okay, in groups of 4, I want you to get together and tell me why the correct answer is B. Draw that nasty diagram of those cranial nerves and what they do at the corpus callosum, and tell me why they have a bitemporal cut in their vision. And so that may be a way of getting them to really understand the information that they can read, and can be some rich discussion. On the other end, this was supposed to be an audience response system question, but I don't think it's going to work. Oh, no, it is. Polling is, it won't be ready till the thing goes up. It's okay for physicians to friend their patients on Facebook. A, strongly agree. B, agree. C, neutral. D, disagree. E, strongly agree. Polling is now open. If you already voted, please vote again, and you have 10 seconds to answer that question. Okay, before I reveal the answer, what objective was I trying to achieve with this type of question, based on what I kind of handed out to you? Anybody want to volunteer? Yeah, generate discussion, because there's no right answer here, I don't think. I mean, I have what I think is right, and of course that's probably right, but, but I bet you somebody 30 years younger than me has a definitely different answer to my answer. So let's see what this group said. E, strongly disagree, 81%. Well, good, everybody agrees with me. So actually almost 100% were at least disagreeing, but there's 4%, and I'd love to know who that person is, who didn't care about that, but nobody agreed. This this is a nice discussion because everybody disagrees. And we could say, why don't you agree? And generate a discussion about Facebook and friending their patients. The American Medical Association, by the way, says that we should not friend our patients. But who listens to the American Medical Association? Okay, this is not a clicker question, but it's the same vein. Medical student abuse is a serious problem in the United States. So you could use that to generate discussion about whether faculty believe that, whether students believe that. If students said, yes, I agree significantly, well, tell me more about that. Tell me if you've experienced it. Let's have that discussion, etc. This is more of the affective type of domain as opposed to the cognitive domain. This one won't work right now because it says polling closed, and I'm not sure why. But let's talk about this. Literature on the use of the audience response system presented in today's talk showed that A, students get better grades when ARS is used compared to discussion. Students perceive they learn better with ARS. Students prefer raising their hands to ARS, and attendance goes down when ARS is used. Okay, so polling is, unfortunately is closed, but we're going to do a raising of hands. Who says A? Who says B? Who says C? Who says D? Made you a little anxious to have to raise your hand, right? Because you don't want to get it right. The answer definitely is students perceive they learn better when ARS. And this group was paying attention. Why did I put this question in? This is a question to see if I got through my talk with the things that I thought are important to the group. But obviously, you would use it for other purposes in your talk. It's more of an assessment of the talk. Okay, let's talk about principles of substance and style in designing a good question. We talked about the importance of designing a purpose. I'd like everybody to think about that every time they're inserting a question in, and we'll get back to that a little bit later. So designing a good question. Have a reason for asking it. There has to be a reason for putting everything in. And maybe it is. That's our tip number 4. I'm going to reiterate that again. And maybe it's just to be cute. And maybe it's an icebreaker. But make sure you know that's why you're using it. Keep the question and the answers simple and brief. Avoid straight memory or factoid questions unless that's your objective. And push application of material, especially for medical students and residents. Not just the binge and purge recall. Limit the number of ARS questions in the lecture. This may get to a review session being a little bit difficult to use them all the time because there is this thing about ARS fatigue. You know, this is, I don't know who most are, but all the literature that I could read, these people seem to think that 5 is probably sufficient, and I probably would agree with that one, but limit them. Don't have them all the time. They take time, too, so you have to take that into consideration. Position the questions at periodic intervals throughout the presentation. And this is a general principle of doing a large group talk, and when I talk about how to give a lecture in one of my discussions, do something different every 15 minutes. I don't care what it is. I don't care if it's even that you go over to your slides and kind of fumble through and make everybody watch you do this for a minute, because I bet you everybody is watching me do this, and so I got you back at the table. But do something different every 15 minutes. A slide is a good idea. This is a talk in and of itself. Use standard good technique for multiple choice questions, and I'll have some examples in a few minutes. And consider having an I don't know as an option, because you could guess and get it right. But I'd want to know if my students just don't know so that I can clarify the misunderstanding and go from there. Questions to avoid, I mean really avoid these in the standard of doing good multiple choice questions, are questions that use the words never, always, or sometimes. Because never is never, always never. Always is not always something always, and sometimes I don't know what that means. Avoid this question. Which of the following is correct? Those of you who are probably where I am right now remember all of our multiple choice questions being like this. 1, 2, and 3, 1, 3, 2, and 4, all the above, none of the above. To this day, I think I know that C is usually 1, 2, and 3, but I just put something different on this one. And then I was looking in Google to try to put something comical in here, and this kind of caught my fancy. Oh, that was cute. Okay, So let's take a blood gas. A very simple question. That's why I was hoping Jamie was here, because I was going to grill him. Let's take a blood gas. Okay? And let's ask this question. And if it says polling open in the top right, then hopefully this is a clicker question. If it says polling closed, it won't be. Okay, so here's a simple question. I show a blood gas, and I ask, what is the primary acid-base disorder? And it's metabolic acidosis, alkalosis, respiratory acidosis, respiratory alkalosis. This is a relatively simple question. You give the people a few minutes to think about it before you even open polling, if polling could be opened. You're thinking right now. You probably have an answer. And I would say, okay, polling is now open. Please vote for the answer. I'm going to role play what I would do as a teacher if this question worked effectively. And these were your responses. Okay, you can see that from the discussion that we had yesterday and the reading I gave you, almost everybody got the fact that this was indeed an acidosis. Okay? Now, the reason why it's an acidosis, because remember that first step that we talked about, is to look at the pH. The pH is 7.29. It's less than 4. So this should be an acidosis. So you have your choice between primary respiratory and metabolic. It is not an alkalosis because the pH is down. So B and D are not correct. So those of you who said B, let's think about looking at the pH first when you're doing a blood gas. The next step is et cetera, et cetera. So I would kind of go through that, try to congratulate the people who got it right. This is Andrew's and my responses. We were just clicking like crazy just to get some responses. And so that's why these are like this. Most of these got it correct. This person needs to know why they're wrong. This person needs to know why they're wrong, but tell them it's not a great, you got it, that's an acidosis. But the pH, but the PCO2 is down. This can't be a respiratory acidosis. This has to be a metabolic acidosis, etc. You could spend about 5 minutes going over what they have already read, what you have already talked about, and getting them to apply the knowledge that they have. If you have a more mature class, and you really want to get them to kind of answer questions more deeply, you could ask a more complicated question. You'd have to give them more time in the reading of the question, in the time clock that you give them, and the explanation. For example, this indeed is a metabolic acidosis, but the next question would be, take a look at this blood gas, and now answer this question. This is not an audience response. And work in groups of 3 and 4, and we'll give you 5 minutes, and you can set the timer for 5 minutes. We'll give you 5 minutes to look at this, and tell me your answer and why that is. You would read it, give them their 5 minutes. At the end of 5 minutes, say, polling is now open, vote for your choice. And the answer turns out to be this one, but they have to take more time because they have to go through what the primary disorder is, use Winter's formula, calculate it, think about the answer, make sure it's appropriate, etc., and go from there. This is a great small group question using the audience response system, either individually or as a group. Another way you could use it is a patient walks into your office with this blood gas. What do you think he or she has? So you give you get a diagnosis and ask them to match the diagnosis to the blood gas. Tip number 5, challenge the learners when you use audience response systems and use that for application. They can read the information and come up with the background knowledge. Have them apply it. Some people say that if everybody gets it right, it's not a good question. It should have a splay. Unless your goal is to make sure everybody understands a very key point that they absolutely have to have before they move on to the next session. So if it's absolutely important that you know a pH less than 4.0 is an acidosis, and you ask a question and 50% get it wrong, you gotta go back and make sure everybody understands it before they can apply it to the patient. Talk a little bit about polling. It's important that you read the question and all the answers. Depending on the complexity after the question and the answers, Pause a few minutes before you do anything differently. Announce when you are ready to start the polling by saying, polling is now open, and it'll be open for 15 seconds so that the students know when to do that frantic clicking. Have a countdown timer. The one question that did work effectively here did show that the countdown timer, you know you got to answer before that thing gets to 0. And then on your countdown timer, which you can set in the Turning Point software, allow sufficient time based on the complexity. If it's pure recall, either you know it or you don't, 10 seconds is sufficient. But if it's that blood gas question, you might want to put the timer for 5 minutes or whatever you think it's necessary to have them accurately discuss it and go through it. And allow sufficient time based on the number of students, which I thought was interesting. They state that there should be less than, if there's less than 30 students, it should be 15 seconds. Between 30 and 100, 30 seconds or greater than 100, 1 minute. And that's an attempt to get everybody into the system such that you can poll everybody and get everybody's responses.
That would be painful though.
Yeah.
30 seconds, unless you had a real question you had to work out.
Yeah, I agree. I agree. Say again, Don? Yeah, yeah, you can, and you can see that on the top, you know.
So you can see how many have
Yes.
responded to the
Yes, yes, you'll see on the, I'm so sorry, the top left-hand side, you'll see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, you'll see all those numbers coming in quickly. And if you know, like now we have probably about 40. Yeah, 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 exactly. You'll see 52, 53, then you say enough. Unless you're giving it for a grade and you say, you got 100 people here and only 70 have answered, those 30 who haven't answered are going to lose this point. Okay, display the responses and give a few seconds for everybody to look at them because they forgot what they might have asked. And you might say, I answered C, I want to see what everybody else did. Just give them a few seconds. And for you to kind of think about the next thought, note the correct answer. In the software, there's a correct answer indicator, and you should note the answer so that everybody knows what the correct one is. And allow time for discussion afterwards, depending on how much discussion you want to have. Be creative, be flexible. Tip number 6, read, answer, and discuss all questions. If you're not putting them in to discuss them, then it's probably not a good reason to have an audience response system question in. Whistles and bells are secondary. There are courses you can take with the software with Turning Point, and I'll have a reference in a second. But whistles and bells are secondary. The same way whistles and bells are secondary in PowerPoint and quite annoying. So get rid of most of the whistle and bells and just be quite simple. Let's talk about designing a good slide. Use standard color schemes. I'm married to black or blue backgrounds with white letters. Some people are married to white background with black letters. That should probably be about it.
I would add some of our lecture halls where we do not have rheostats and it's the lights are on or the lights are off. You have all the lights off and you have a black background. Your ambient light in the room is so dark that students fall asleep. So if you're in the room without,
That's the excuse, huh?
well, if you're in a room without a rheostat, use a white background with black lettering and it'll throw more light out into the room.
Thank you. But I think that's your choices. This, you know, I mean, highlight with red, to highlight with yellow, to highlight with green is okay. But in general, stark contrast between dark and light. Use at least 32-point font. So that means your questions have to be quite simple. People in the back of the room generally can't see font that's very small. Make sure your answer options match the keypad. Let me see what's your keypad. But you can see this keypad is taking that into consideration. So 1 is obviously A and 2 is B. But some keypads are 1, 2, 3, 4, and 5. And on your slide, you have A, B, C, D, and E. So the student can be confused. In ours, 1 is A, 2 is B, 3 is C. But make sure you know your equipment. No more than 5 answer choices. After that, it's kind of silly. And review your slides for content and style. I would underline that tremendously. Review your slides for content and style. This is general good slide principles anytime you give a PowerPoint type of discussion. And finally, I want to talk about logistics, and isn't that very important that we talk about logistics in a slideshow that didn't really pan out all that well. But I must tell you, for a disclaimer, that I did work with Andrew on Wednesday, and all of these slides did work. So things can fail on you, and it can be very disappointing, and I apologize for that. Nonetheless, making sure that things work, I can test the system in the proposed location to identify technical issues, and on the day of the actual session, come early, allow time for the clickers to be sent out, etc. Those simple things. And rehearse the actual presentation to make sure it'll run smoothly, which I assure you once again I did, and also for the timing of such, because audience response systems can take time. So when I rehearsed this slide among myself, when I was talking about some of those questions, I said, okay, I'm going to leave about 3 minutes in my talk for that question. So I practiced it. When I got to that point, I said, okay, add 3 minutes, and I finished on time. So practice the timing of such, because these do take more time than you think they would. These are boring kind of things, but they can, as you can well know, make or break the success of a talk. Make sure you have tested the equipment in the actual location of your talk. Here are some summary slides, the AEIOUs of the ARS, as told by me. Use them to assess deeper learning. Use them to engage and entertain the learner, because engagement and entertaining are important, and it does set a nice learning climate. Use them not to irritate your students. Think about what irritates you, and don't do that. Use it to help you organize your learning points. Start at the beginning of the talk and think, what 4 things might I want my students to absolutely know at the end of this lecture? That's what I'm going to put my audience response systems slide in to help me assess that. And then finally, use it to help understand where you and your learners are. So are you getting your points across? Are they understanding your points? Assess, engage, irritate not, organize, and understand. Some errors of novices and experts include questions that have no purpose or serve the wrong purpose. Questions are too easy. If everybody gets everything right, you may think you're a great teacher, but it probably is not a great question. There should be some people who have something wrong, make it more difficult so that you can discuss errors. Questions that are purely factoid. It can lead to ARS fatigue, which is probably out there. Asking too many questions. The question is asked and then never answered or addressed. And the instructor doesn't provide adequate time for either the doing of the question or the discussion of the question. And lack of communication with your audience response system support. I think everybody should know how to use the system to make the questions, but everything else may not be as important. And find your audience response system support person that can help you out with that. So I was hoping to have this question at the end, 2 questions at the end. I feel more confident in the effective use of ARS and the ARS system. Yes, no, or not sure. Using this to see whether this talk was helpful to a group of educators. And finally, the last question. I'm going to press this button real slight. No. What is running through your head right now? Oh God, not another slide. I hope she finishes soon. Wonder what I'm having for dinner tonight. This has been really helpful. Or I made this slide before the demise, which is my preparatory neuroses. I prepared this about 2 weeks ago. Let's go, pens. Okay, summary. Have a purpose to every question. Challenge your learners, but keep the questions and answers simple. Announce and allow adequate time for polling. Read, answer, and discuss questions. Spend time on the discussion. That's why they should be there. The rest are bells and whistles. 3 to 4 to 5 questions in a 50-minute talk, no more. Make sure your equipment is set up. This is a page from the OMED website that talks about the use of PowerPoint. These are 2 podcasts that are apparently available. That is an overview of the use of the ARS and kind of a tutorial on using it. I thought this was going to be up and available, and I thought, oh, I could use this as kind of a way to talk to my audience on Friday. And when I clicked on it, it wasn't functional. Having said that, they're working on it right now. When this is up and running, I'll email the group, but these are tutorials on the overview and using PowerPoint. And Casey's working on making this live and active shortly, but it is on the OMED website. There's literature on it. It's not worth reading in general because it's not that helpful. And that's about the extent that I wanted to kind of talk about this. When this is up and running, I'll let you know. Two final announcements. Next Friday is Dina Hofkosh talking about giving difficult feedback when it has to do with personal issues, not so much the cognitive domain. And the second is the evaluation forms. If you could fill those out today, that would be helpful for my administrator in getting this in on time. I thank everybody very much. If there's time for questions. Oh, the index card is for suggestions for subsequent topics next year in the Academy series dealing with faculty development or mentoring. You know, needs assessment from the group is important. So if you have any topics that you think are interesting, and really nicely, if you'd be willing to give a topic, please put that down on the index card, leave it here, I'll collect it afterwards. And so thank you very much. If anybody has any questions or comments, I'd be willing to take them up front. So that's because it's 9 o'clock. Thank you. Yes, ma'am.